and welcome to the Dr. Bob Show. Are you having trouble putting on last year's clothes? Are they a little too tight? Did your doctor tell you you've gained 8 pounds or 20 pounds or you've got to lose 50 pounds? We'll be spending most of this show talking about the difference between being overweight and being obese and the medical problems that will follow if we don't get our weight properly. Are there medications that we can use to help, and maybe is there surgery? My guest is Dr. Bill Law, board-certified endocrinologist, and Dr. Jean Overholt, board-certified gastroenterologist. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about dangers of obstructive sleep apnea and how do you get sinusitis, why do you get it, and what could you do for it? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Bill Law, board-certified endocrinologist, and we've been talking about the difference from being overweight or obese and the dangers. Bill, welcome to the Dr. Bob Show.
Thank you, Bob.
What is the difference between being overweight and medically obese?
It's a question of degree. It's sort of like being a little bit pregnant or a lot pregnant. You can have a little bit extra weight or a little bit more, and it's ultimately gets to be sort of like a rock rolling down the hill. The faster it goes, the heavier it is, the harder it is to stop, and the worse it gets.
So there's a huge difference. Now, we mentioned in the opening the difference between 8 pounds weight loss and 20-pound weight loss and 50-pound weight loss. Is it difficult for people to lose weight?
Is it difficult for pigs to fly?
Yeah, it really is. Pigs don't fly.
It's very difficult for the people to lose weight, and the problem is the more weight you have, the more difficult it is because it takes more and more and more energy to move that weight.
When people get terribly overweight, when they're 30, 50, 100 pounds overweight, do they just feel poorly then?
They feel, well, imagine, Bobby, now imagine how you would have felt at age 18 if they said, no, wait a minute, you can't get out of bed yet. You got to put on a 100-pound pack, and you got to carry it every step of the way. I mean, even at age 18, I don't know about you, I'd have probably just laid there like a big turtle and died. So to then at age 40 or 50 or 60 or 70 be carrying around 50 or 75 or 100 pounds more than your heart had to pump blood for at age 18, or your lungs had to exchange oxygen for, or your hips and knees and ankles had to carry around. I mean, it's exhausting every day.
It really gets to be a huge problem, and the heavier you get, sometimes it's harder to exercise. Let's go back to being overweight. What type of medical problems does being overweight cause?
Well, it puts a big strain on all of your vital organs.
For instance?
The heart has to pump more blood. You have more trouble with heart disease. Cholesterol builds up. You have more trouble with cholesterol elevation. So that blocks up arteries. You get strokes, heart attacks. Blood pressure goes up. The heart has to pump harder. So you get high blood pressure. It makes it very hard on the pancreas gland that makes insulin to produce enough insulin to overcome the resistance to insulin that you get when you get heavy. So diabetes gets progressively more. It's harder to breathe, so you get sleep apnea. You could go on and on. Every body system is put under major growing stress as you pack more pounds on.
So it's one of the causes of snoring and obstructive sleep apnea.
Absolutely.
It's one of the causes of getting, or is it the cause, or is it one of the reasons we get type 2 diabetes? Why does obesity make people more prone to get type 2 diabetes?
Well, imagine the fact that insulin is a storage hormone. It takes out insulin, it takes sugar out of the bloodstream and puts it in the cells. Well, the cells either got to burn it up to meet your energy or store it as fat. Well, after you got enough stored energy, the body says, whoa, wait just a minute. I got enough energy here to last through the next 3 famines. It's not healthy for you to make me store more. I'm going to get resistant. And so it's like an arms race. The heavier you get, the more insulin it takes to overcome that and keep the sugar down, and you can always out-eat it.
When the insulin, you can always out-eat it. When the insulin goes up, does that tell the brain you're hungry and you need more calories?
So it's a self-perpetuating problem.
It's a vicious cycle.
Vicious cycle.
How do we help people lose weight? What do we tell them to do?
You mean other than see a dentist and get their jaw wired?
So
yeah. No.
Eat less.
Eat less and exercise more. When it comes to diabetes, what you eat can make a big difference in the sugar level. Comes to cholesterol, what you eat can make some difference in the cholesterol. When it comes to weight, it's pure physics. It's calories taken in, calories burned up. I mean, a lumberjack will eat 5,000 calories a day, and about as big around as my little finger. Most of us aren't lumberjacks, or even close. And so if you don't burn up many calories, it doesn't take many calories to match up. Most people that we see in our metabolic-related practice aren't gluttons. They don't eat anything more than anybody else. They just don't burn up much. And it's calories in, calories burned up. So you got to change that balance. You either have to take in fewer or burn up more, or maybe a little bit of both to create a difference there that forces you to burn up your fat stores.
So we eat less, we eat better kinds of foods, we exercise more, but if we're overweight and we have bad knees and bad hips, it's hard to exercise, and so we use less calories, vicious cycle. Are any medicines that can help losing weight?
There are a number of medicines that have been approved for appetite suppression, and they all work some. The problem is that the body quickly becomes tolerant, if you will, of them. And what I've seen in 30 years of playing doctor is that for the people that respond, and a lot of people do respond initially, they'll lose weight in that first 2 or 3 months, and then despite continuing the medicine, it sort of plateaus. Well, they're paying for all this out of pocket because most of the insurance companies don't cover those medicines. So after a few months of doing that and not seeing any more weight loss, they say, I can't justify this anymore. So then they stop the medicine. 3 months later, they're heavier than they were to start with, and about $1,000 poorer.
Weight loss programs?
They work well if you stick with them. Things like Weight Watchers, Sure Losers, Nutrisystem, things that give a structure, a game plan. Do this, do that, don't do this, don't do that. They can be very, very helpful for long-term success, but you have to stick to it, and that's the problem.
I hear so many people say, I've got to get back on the plan that I'm on because I stopped it and I'm gaining weight, and I've been back on it 3 pounds, and they do lose the weight with that. When you lose weight, does your brain tell you that you need to gain it back? Are there some things that the brain does that make us want to get back or gain more, as you said with that other person?
Excellent question. Short answer is we don't know. We're starting to identify a number of different hormones in the blood that come, they come from the portions of the bowel, and they can stimulate our nerve reflexes. The hormones, they can tell the body, I need some food. You know, you've got that big old stomach there, holds about 20-some ounces, and if it's empty, there's nerves in the lining of that stomach that fire back up to the brain and say, feed me. And so empty stomachs, you know, people don't like that.
So if everything's unsuccessful, if exercise not enough, we eat too much food, not less enough, medicines don't help, is surgery an answer? I remember you saying on Dr. Bob's show, I'm not sure, maybe surgery may be the treatment of choice with people with overweight with type 2 diabetes.
Well, nobody really likes to say, yep, you need surgery. But I got to tell you now, I have a growing number of former patients that don't need me anymore because they've had bariatric surgery and they've lost about 100 pounds and their sugar is normal with no insulin or pills. Their blood pressures come back way down. Their cholesterol's normal. They're not putting all that weight on their knees, hips, and ankles so they can be more active. And the weight loss becomes a self-perpetuating solution. Unfortunately, bariatric surgery, even nowadays when we're much better at it than we used to be, much better success, much less risky, it's still very expensive, and a lot of insurance companies, unfortunately, won't cover it. So,
it's difficult to lose weight. Is there a way we could do bariatric surgery, bypass surgery, and help lose weight without having to go to the operating room, spending lots of money? We'll talk about that. You're going to want to stay tuned. There's some new advances that are coming out that could help you, could help me, and could help the world. And now we're talking with Dr. Gene Overholt, my brother, board-certified gastroenterologist. And we're going to be talking about gastroenterology and how it interacts with being overweight and the problems with being overweight. I wanted to talk a little bit about bariatric surgery. And bariatric surgery is where we bypass the small bowel. One of the things, the newer things in bariatric surgery is called a gastric sleeve. The stomach is built like this. If we can cut off that greater curvature, that's where the hormones that are released that go up to the brain that say, I'm hungry, or I'm just not full yet. So there's a bariatric surgery, gastric sleeve, where you cut off the greater curvature of the stomach and you make a little stomach that then bypasses everything. Gene, welcome to the Dr. Bob Show.
Thanks, Bob.
Tell me where being overweight interferes with people from a GI standpoint.
That's one of our commonest problems. Excessive weight gain is primarily in the abdomen, and that causes pressure, so that reflux or heartburn is a big problem. A fatty liver, in fact, fatty liver is the commonest cause of cirrhosis for the future.
I have never seen as much fatty liver as I've seen. Back in the old days, I don't know that I didn't think fatty liver was drinking too much. You get fatty liver without alcohol intake.
Absolutely. The commonest cause of fatty liver is what we call non-alcoholic fatty liver disease.
So you've got reflux disease, you've got liver disease, anything else being overweight causes?
Colon cancer is associated with being overweight. I'm not sure why, but it does occur. So those are the big three.
Those are huge three.
Yes.
From a GI standpoint, then if somebody comes in and they're overweight and they've got reflux or they've got fatty liver, you have to tell them to lose that weight, or what do you do?
Well, we encourage them strongly to lose weight. We monitor their weight loss. We put them on diets and a weight loss program.
So that's when patients come to my office and they say, your brother told me I was overweight and I had to lose weight. And I said, he's the mean guy.
Right.
So is it hard for patients to lose weight? If they've really got disease process and you really tell them, can they lose weight?
Very hard. People, if they're motivated, will lose 10 or maybe 15 pounds, but then their motivation begins to taper off and they gain that weight back. It's very difficult to lose weight and keep it off long term.
You and I have talked a long time about, it seems like instead of doing surgery, you could do something where somebody wouldn't have to go to the operating room, and yet you could bypass the stomach. If you could place a tube down in from the esophagus through the stomach, or do something like that. What are the chances of that being done now?
They're great. The chances are great. There is a clinical trial, an experimental device that can be inserted to help bypass part of the small intestine that will facilitate weight loss, but is aimed primarily at the control of type 2 diabetes.
So if you've got type 2 diabetes, you're overweight, you've got insulin resistance, the insulin doesn't work, and if you lose that weight, the insulin resistance goes away. So what are some of the options that we can do?
Well, there are devices such as balloons that can be placed into the stomach to just take up space. But the most current one, the one that's exciting, is what we call EndoSleeve.
Now, endo sleeve would mean like a gastric sleeve, bariatric surgery, except you don't have to have the surgery. Tell me, what do you mean?
The EndoSleeve is a 2-foot flexible thin liner for the intestine that's attached right beyond the end of the stomach and goes down 2 feet. It bypasses, it's impermeable, and bypasses the first 2 feet of the small intestine.
So you've got a stomach there. Show me, and let's go through that and see if I can figure out what's going on here. Basically, show me what we've got here. This is, I know, this is the stomach. Now, whereabouts are we?
Here is the stomach. This device is put down with a scope through the mouth, and it's run through the stomach. It attaches right beyond the end of the stomach.
Is that called the duodenum?
The duodenum, and then the liner is threaded down 2 feet into the small intestines. It's impermeable, so you bypass this area.
And is that area where a lot of absorption of food and for calories goes?
That's where primary absorption occurs, but that's not the only mechanism for how this works. In fact, we don't really know how it works. We think it has to do with the release of hormones and the way the body reacts to ingested food.
How about where the gallbladder puts in enzymes that digest fat? Do the fatty foods therefore not get digested? Do they pass through this?
The bile that is introduced from the gallbladder enters in here, and it just slides down and meets the food down at that level. It probably has something to do with the release of hormones from this area of the small intestine.
Now, to me, that looks like saran wrap. You said it's impermeable. What does that mean? If you swallow food, comes down to the stomach, goes into the stomach, goes to the duodenum. In the stomach, what happens to food?
Well, the stomach is a muscular organ, and the food is churned up, macerated, prepared for digestion, and then it passes into the area of the small intestine where absorption occurs.
So you're going to then bypass 2 feet. Well, what if you made that saran wrap, that impermeable membrane? What if you how big is the small bowel?
Well, the small intestine is 15 to 18 feet.
So it's 18 feet. What if you made this longer? Instead of being 2 feet, what if you made it 15 feet or past the whole thing?
Come back in a couple of years and we'll do another clinical trial. But let me mention that this membrane, which is impermeable, it doesn't allow passage of food or nutrients, is a special polymer. It's not a saran wrap thing. It's a very specialized polymer material.
So does it, being a special polymer material, it just doesn't let the food that's been churned and macerated, it doesn't let the digested food come into the small bowel, it passes through?
For the first 2 feet, yes.
Okay. So
but it also has to do with the interaction when food is absorbed in that area of the small intestine. Normally, it has a release of hormones, insulin, other types of hormones that control appetite and control other foods. So we're not sure how this works, but it's not just malabsorption. It has to do with hormone release.
Can the people just do this? Is this the easy fix? You don't have to exercise, you don't have to eat right, you don't have to do anything, you just have this done?
Well, this will work. It's being used to test its control of diabetes mellitus type 2, but also it will impact weight gain, or weight loss. This is not the answer in itself to weight loss. It's a combination of exercise, diet, device such as this. It's behavior modification over a period of time.
Now, is it difficult to insert there? How do you get it to stop at the duodenum? Why doesn't it slide through? And if it's easy to insert there, is it difficult to take out? How long do you keep it in? I've got a million questions I want to ask you right here.
The device is left in for about a year, and then you can take it out through a scope. It's placed by the scope. There are little wires here that attach it to the first part of the duodenum so it will stay in place. And then you leave it in for a year, and it can be removed with a special scope also.
Hard?
Takes about 20 to 30 minutes. Has to be done under x-ray control. Has to be done by somebody who's trained and skilled.
Now, this is in a clinical trial. What does that mean?
It means that people are screened if they are type 2 diabetics and they're overweight and they meet certain other criteria, they can participate in a clinical trial. This particular trial has a 2-to-1 enrollment. That means that 2 people, and it's randomly selected, 2 people will receive the device and 1 will have a sham.
So that's the placebo control there.
Yes.
Yeah, and that's what has to be in every good medical. Do you have any thoughts about how much weight people can lose? And if you take it out, does their weight come right back? Any thoughts on that? Or that's come back and we'll talk about that also.
We don't have any experience in the United States that would answer those questions. In foreign countries where this is approved, such as Australia and South America and some European countries, they're experiencing somewhere in they report 30 to 60 pounds of weight loss. And after it is removed, a significant percentage of people are maintaining that weight loss.
So this is done through endoscope. You don't have to go to the operating room. You don't have to have surgery. You don't have any of those problems. It may be, we'll just have to wait and see, our answers to what everybody's wanted. Gene, thank you so much for coming and sharing this. You're a great teacher, and I always enjoy having you on this show.
Thanks, Dr. Bob.
So this is a clinical trial, not really ready in the United States without going through a clinical trial. I'm hoping that clinical trials like that will help you and me and will help us lose weight so that diabetes and heart disease and the problems with being overweight will go away, so that we won't have fatty liver, so that we won't have colon cancer and breast cancer that increase with being obese, so that we won't have so bad reflux because of being overweight. If you and I can get on some plan that helps us lose weight, we can improve our health in the United States. I want to thank Dr. Gene Overholt and Dr. Bill Law. Wonderful discussion. Later on, we're going to be talking about those 4 things that you like in the Dr. Bob Show. I want to thank Dr. Gene Overholt and Dr. Bill Law for wonderful discussions on the main problem with health in the United States, being overweight. I'm very hopeful that this show will help you and I be a healthier person, to live a healthier life and get our weight proper. And now for questions from you, the viewer, that I think will be important to your health. I have 2 questions, and I've only got time for one. Dr. Bob, what are the dangers of obstructive sleep apnea? Obstructive sleep apnea, as you know, is where we stop breathing during the middle of the night when we're snoring. When we stop breathing, there is no oxygen that gets to the brain. There's no oxygen that gets to the tissues. When that happens, the adrenal gland says something wrong is going on. So the adrenal gland puts out hormones that raise our blood pressure, that make it where we've got more epinephrine hormones that stimulate the heart, so we get arrhythmias, we can get heart attacks. We can get insulin resistance that occurs. It increases the incidence of type 2 diabetes. We wake up in the morning with headaches because the brain hasn't had the oxygen that it needs. If you stop breathing because of snoring, be sure and see your doctor. Talk about getting a sleep study. And that's all the time that we have for this show. Remember, those 4 things. We need to be exercising. If we exercise 60 minutes every day, just getting out and walking and exercising, it will reduce stress, it'll help us lose weight, and we'll be healthier people. Remember that sleep is so important for you in your life. Be sure that you sleep well. There are over 100 disorders that make us where we don't sleep properly. So if you don't know how to go to sleep, have that room nice and dark, soft pillows, quiet room. Watch the medicines that you take that they don't keep you awake, and make your sleep a healthy and happy sleep. Remember, if you're sleeping well, then you'll be happier and healthier the next day. How's your eating habits? Are we eating enough fruits and vegetables? Are we eating too much fatty foods? Are we spending too much time eating foods that are improper for our life? Well, remember, enjoy what you're eating. Look down at your plate and say, wow, I don't need to eat all of that. It looks like there's not much on my plate. So push 2/3 of it away and only eat 2/3. Eat it slower. Have a good time when you eat. And also remember, what is it we like most in the Dr. Bob Show? Is that laughter in your life. What does laughter do for us? We know that laughter affects the immune system. It makes it where we fight off infection better. We know that laughter and being happy is contagious, so that if we laugh, we feel happier and other people feel happier. And so around the room, people laugh a lot and they are healthier. I had a friend say, Dr. Bob, it's nice to hear your voice on the phone. It's nice to hear your laughter. So remember that laughter in your life will make you healthier. So how do we do that? We tell stories. If we can laugh at ourselves, we're always going to be better. So make sure that that laughter is part of your life. And when you laugh a lot, you're going to stay healthier. Your immune system will work better. You'll feel more refreshed. You'll be happier. You'll perform more. People around you will be happier. And you'll stay healthier. So laugh, 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 and you'll stay healthy.